guys, I'm Sophie, and today we are back at Brighton Foot and Ankle talking to Dr. Castelein just to get to know a little bit more about his educational history. So Dr. Castelein, go ahead and tell me a little bit about your educational background.
Thanks, Sophie. So I grew up in a smaller town in Wisconsin and was able to go to a really ironic name high school, Bigfoot High School. This came out to be a little bit of a point of confusion, or honestly, a joke, as I went to undergrad outside of Wisconsin. In Dayton, Ohio, I went to the University of Dayton, where I was able to get a degree in accounting and also a minor in biology. I was kind of interested in both business and medicine at that time. After graduating University of Dayton, I was able to go on to a one-year postgraduate study program at Midwestern University, where there I kind of found out about podiatry, and I kind of found out that that was something that I wanted to do. So then I applied to Dr. Scholl College of Podiatric Medicine, which is in Chicago. While I was in Chicago for my 4 years, I was able to get a degree in healthcare administration, which was a master's, as well as my doctorate of podiatric medicine.
Wow, very interesting. So then where did you do your residency at?
So after my 4 years of medical school or podiatry school, I then was able to do a 3-year surgical-based training at Genesis Hospital in Grand Lake, Michigan.
Okay. So then during your time in residency, were you able to acquire any additional training?
Yeah, so residency was great. We had a lot of focus on reconstructive procedures of the foot and ankle. Genesis was a level 2 trauma center, so we were able to see a lot of trauma. We of course had diabetic care, wound care, but one of the cool things about that residency is we had a good focus in MIS procedures, or minimally invasive procedures, which is where we use a lot of x-ray in the operating room to make very small incisions. We are also able to get trained very well in using cameras called arthroscopy, so that way again we can see different structures of the foot and the ankle with using very small incisions. I was also able to do a 2-week little mini fellowship in dermatology, and that was down in Georgia.
Very cool. And then since residency, have you acquired any other certifications?
Yeah, so after residency, I like to stay up with different techniques and new tricks and new surgical procedures that we're seeing. So that does involve a lot of little seminars, which thankfully they're usually in warm climates, and here in Michigan, it's a good excuse to get out of the Michigan winters. But there's also 2 big board certifications in podiatry. We have the ABPM, which really kind of focuses on medicine-based conservative treatments of the foot and ankle, and I was able to sit and obtain that certification. There's a more involved, expansive, it takes several years to get, that's the ABFAS certification, and they break their certification into what they call the foot, which is just the front side of the foot, and I was able to take that and get certified in foot surgery. They also have another second component, which is rear foot and ankle certification, and I did go on and get the rear foot and ankle certification as well.
Very cool. So then when were you able to transition into owning your own practice?
Thanks. So a couple years after residency in 2019, I was able to acquire Brighton Foot and Ankle, and since that time I have been practicing solo and providing care in Brighton.
Very cool. And then what interests you the most about the foot and ankle?
So one of my big things with our clinic here in Brighton is we really want to service our area. We really want to treat people in the greater Brighton area and treat them at the highest level of care. So we don't really turn down any pathology or any conditions or any problems people have, which means I think our youngest patient has been only a few months old, and every once in a while we do get someone who is over 100 years old. So we see all things here. We see skin conditions, we see diabetic care, we see ulcers, but some of my favorite stuff is when people break things, we get to go fix that, so that's like trauma, or also kind of put the foot back together to return people to their activities, like reconstructive surgery or sports medicine.
Okay, so it sounds like you kind of handle a little bit of everything here.
Yes, we do.
All right, well that's all I have for you today. Thank you for taking the time to answer my questions.
All right, thank you.